କେତେ ଏଜ୍ କହିଲା?
30 30 ତ?
30 years male, complaints of the left radicular pain for last 1 year. Is working in a industry where to lift the goods every day. So while lifting the goods, he catch a breath, and suddenly there was a pain. Managed with the conservative treatment, it was all right, but intermittently there was a pain, and now it is almost incapable, not going to work for last 3 months, and severe pain, radicular pain left side, right is not pain, and there is weakness, tingling, numbness, but there is bladder bowl involvement, there is no bladder bowl involvement. Patient is not able to walk beyond 1.5 kilometers, but severe pain after that, and even the night pain, even the change of position he is feeling pain, tingling, numbness, weakness of the left lower limb, more on the S1 nerve root than the L5 nerve root, but both the nerve root involved. L4-L5 and L5-S1, disc herniation, left side nerve root compression. We plan to do the discectomy at L5-S1 and L4-L5. The L5-S1 is more than the L4-L5, so we are approaching from the left side. This is the L5 lamina, S1 lamina, facet and the spinous process, cranial, caudal, midline, lateral, left approach. Now we are detaching the ligamentum flavum caudally. This is the detaching the deep layer of the ligamentum flavum here, deep layer of the ligamentum flavum from the inferior lamina. So this is the caudal pity, and both cranial and caudal pity were introduced to protect the nerve root and the dura. dispersor. Discuss. The medial aspect of the SAP to remove this big hypertrophy, not much, but to remove this one, then the nerve root will be decompressed completely up to the foramen. So this is the primary motto of the surgery, the nerve root decompressed. Glucoredia.
Glucoredia. ଅଛନ୍ତି?
Dispersor. Deep layer of the ligamentum flavum. 45. Dispersor. So nerve root is now clear up to the foramen. We are at the disc space in front of the disc space. We are putting the cranial petty to just push the nerve root and the dura a little bit medially. This is my cranial petty. Then I have to dissect. This is my nerve root. I am dissecting. Here it is little bit addition with the disc. This is the disc. and this is the now it's clear. Look at that.
देखो
देखुच टीवी को देखुच देखा चश्मा पिंधि देखा देखा यहाँ देख धक धक हो देखिले कि नहीं यहाँ यहाँ ब्रेन रो जो कनेक्शनटा जाऊँगी सुषुम्ना कांड बा स्पाइनल कॉर्ड तादर बाहर नर्व यहाँ गोड़ को जाटार नर्व यारी तले यहाँ बाहर की बस यहाँ डिस्क देखिपुच यहाँ डिस्क यहाँ बाहर की थिला पूरा फटेब फटेब अवस्था थिला टिके ना छुईला मात्र फाटीगला से अवस्था से टुलक भाया गोटे हो महादेव भाया थिला रास्ताटा आम क्लीयर कर बर्तमान यहाँ आसिक चिपुला बोली पेन होता यहाँ काढ़ीदेला पेन हेन ये बहुत बड़ बड़ देखा यहाँ हूँ 55 इंच 3D 4K कैमेरा सो मैग्निफिकेशन इज वेरी वेरी हाई देखिए केते मोटा मोटा देखा बड़ भारी आस सब मेचे मेचे से आसिक पेन होता दैट वाज कंप्रेसिंग टू द नर्व रूट ना सरकार मना कर बहुत गुड़ा ता भीतर थिला से कष्ट हो ऑलमोस्ट भितर क्लियर हो गला तथापि आम आहरी टे डबल शेयर होगापी विल गो इनसाइड एंड विल सी विल गो इनसाइड डायरेक्ट हाँ क्लियर पूरा किसी ना पूरा क्लियर है फोटो 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 चल Now we'll irrigate this space with normal saline and gentamicin. Antibiotic, जदि भी किसी कुकुर मुकुर छोटिया मोटिया थी से भी with pressure of the normal saline it will come out. Small tiny fragment also it cannot stay with water pressure, it will come out. This first. पूरा नर्व रूट एकदम क्लियर होगा धक धक हो स्पाइनल कॉर्ड एवरीथिंग क्लियर हाँ जा थैंक यू जा तुम जा हो गला ता काम आ गोटे लेवल आम करदे बस बस चलो Static देखा the amount of the disc we have removed. Now we'll see.
Light on.
The amount of the disc we have removed. चढ़ चढ़ हाँ हेलो लाइव चलছি ठीक है 30 years male that complains of the severe left radicular pain for years while lifting a heavy weight, sudden jerk and breath, catch of breath leads to the disc herniation. It is two level L5-S1 and L4-L5. L5-S1 we have already done the discectomy, the left approach. Now this is the L4-L5. This is the same left approach again. So this is the L4 lamina, this is the spinous process. L5 lamina, this is the facet. So cranial, caudal, midline, lateral, left approach, and this is the L5-S1 we have already operated. Now we are trying to detach the ligamentum flavum caudally from the L5 lamina here. Foot switch उठे दे बाबा.
Bill foot switch लियो.
This is the caudal lamina. I am trying to detach the ligamentum flavum from the caudal lamina. This is the deep layer of the ligamentum flavum. Superficial layer already we have removed. And this is the deep layer. Here there is a foramen, so I have to trim a bit of the bone from the roof of the foramen to decompress the nerve root of the foramen. At the same time, I have to see that how much the left out bone of the L5 lamina, because the L4-L5 they are operating, but L5-S1 already done. So that also you have to keep in mind. Now this is the deep layer of the ligamentum flavum. This cursor. Petty. So now we will put the petty, one cranial and caudal, so that the dura will be protected. Okay, so that was the cranial petty, and this is my caudal petty. It is just on the nerve root. Nerve root is visible. We are at the axilla. My petty is at the axilla. Now we have to trim a bit of the ligamentum flavum along with the medial aspect of the facet to decompress the lateral viscera completely, and up to the foramen the nerve root should be decompressed. So this is the attachment of the ligamentum flavum to the facet. We are just trimming a bit of the SAP here. This is the supraarticular process of the L5 vertebra. The medial aspect of the SAP, just 2 to 3 millimeter of the bone we are trimming. My addition is 3 millimeter. Just trimming a bit of the medial aspect of the SAP to decompress the nerve root up to the foramen. Now it is done. Now the disc. So now we will trace the nerve root up to the foramen. First we will put the cranial petty and to push the nerve root bit medially. This is the caudal petty. And this is my disc. And it is bit adherent, 1 year old. So there is something here, the disc cursor. So this left out small pieces of the ligamentum flavum is not allowing me to go inside. That petty is not allowed to push. I am just trimming a bit of the ligamentum flavum. Yes, now petty. Now put the cranial petty. better blade. My 11 number blade to cut the annulus. Annulotomy done. Now this is the disc. Yes. Oh.
फोटो ले लो
Big piece.
फोटो 20 पे लेकर
So MRI was not so much of alarming, but see the practical thing. That's why the patient having the pain, severe pain, a huge disc. Always consider the clinical picture and patient complaint first, and then see the MRI and correlate. You may not get the proper. Sometimes in MRI you will see the huge disc, but patient complaint is minimal. So that happens most of the time. The correlation with the MRI to the patient symptom is the most important. So how much disc we have removed, just can imagine. A lot of disc. Still there are few fragments are coming. Must we have removed more than 5 gram from the L4-L5 and 4 gram around L5-S1. Now we will have a look into this space with the telescope through the operating put directly into the space. There is no more free fragment, and we have removed everything. This space. Now we will irrigate the disc space with normal saline and gentamicin. Small tiny fragment also push out with the pressure of the normal saline, and we are putting normal saline which is mixed with the gentamicin also, so it protected, take care of the so it is big piece has come out with the pressure of the normal saline. by this person. So maybe some fragment is still coming out. Yes. Yes. So two pieces, two fragments were still there inside. It has come out with the normal saline pressure. So very nice.
ପାଣି ଆଉ ଟିକେ ଦିଅ ଏମିତି କଣ କର
ସେଟା
ଏଇଟା ହଉଛି ଆପଣ ପକାଅ
So very nicely decompress the nerve root up to the foramen. Yes, was surgical gel foam. Now we will clean thoroughly everywhere. Maybe some bone particle during drilling of the cranial lamina. So we are just cleaning everything everywhere, all corners thoroughly with the gentamicin or normal saline. Okay. Now
ରେଡି କର
to maintain the hemostasis, we will put a petty. So very nice. Now the disc bar kar la bar kar. So this is the amount of the disc. Okay. Dita jak misikiri. Okay. Rara. Chal. Okay. Thank you. Thank you very much. Light source off. Camera off. No.